Today we are going to discuss pedal edema and CKD, their causes, symptoms and treatment. In today's session, we will discuss chronic kidney disease or CKD and its association to pedal edema, along with its causes, symptoms and treatment. First, let's see what chronic kidney disease is. The continuing and permanent degeneration of the kidney is known as chronic kidney disease. The kidneys, as we know, the kidneys are a vital organ in the human body. They serve a variety of purposes, including maintaining the body mineral electrolyte balance, assisting in the production of red blood cells, maintaining the acid-base balance of the blood, or excreting water-soluble waste. Kidneys that have been damaged lose their capacity to execute these functions, as I mentioned before. Coming to the chronic kidney disease, there are 5 stages of CKDs. In CKD stage 1, the kidney is almost normal with more than 90% of the kidney functioning properly. In stage 2, the kidney function mildly decreases to 60 to 89%. Coming to stage 3, the kidney function decreases mild to moderate to about 30 to 59%. In stage 4, the kidney function severely decreases to 15 to 29%. While in CKD stage 5, there is a kidney failure and the presence of kidney function is less than 15%. Since, as we know, the kidney can compensate for the lost function, signs and symptoms may not appear until permanent damage has been occurred. Some of the commonly observed CKD symptoms, depending on the severity, whether it is CKD stage 2, 3, 4 or 5, the symptoms can be seen are swelling of the feet and ankles or pedal edema, nausea, vomiting, lack of appetite, bhook kam lag raha, sleep problems, urinating more or less, oliguric or anuric or increased frequency of urine as well, diminished mental sharpness, muscular cramps, high blood pressure, shortness of breath. As we look at the signs and symptoms of CKD, one of the major symptoms is pedal edema that we are going to talk about. And pedal edema, mostly we will see swelling of the legs, and also you can see puffiness of the face, and in sometimes wherein you can see the abdominal distension as well. Pedal edema is a swelling of the feet and ankles caused by abnormal buildup of the fluid in the ankles, feet and lower legs. Edema of the foot can be caused by 2 different mechanisms and can happen in unison or separately. Can happen in unilateral one leg or both leg, or in one leg or both leg. Let us see how pedal edema is linked to CKD. Edema forms in patients with CKD for 2 reasons, either due to heavy loss of protein in the urine, majorly when we see in the patient on nephrotic syndrome, and impaired kidney function. As I just spoke about the proteinuria in nephrotic syndrome, nephrotic syndrome is defined as significant loss of protein in the urine along with edema. The decrease in protein called albumin in the blood results in reduction in the fluid in the blood vessels. The kidney can then detect a decrease in blood volume and attempt to retain salt. As a result, fluid collects in the tissue, resulting in edema. Pedal edema can also occur when someone stands or sits in the same posture for the prolonged period of time. The symptoms of pedal edema symptoms include swelling, puffiness of the tissue just beneath the skin that is stretched or shiny, skin that retains a dimple, pits after being pressed for several seconds. जैसा कि हम जानते हैं, अगर पैर को अगर थोड़े सा प्रेस करके रखते हैं तो उसमें गड्ढे से बन जाते हैं. Let's take a look at the way to reduce how pedal edema can be reduced, caused mainly due to CKDs. Treatment of edema includes addressing the underlying cause. You have to look for the underlying cause. Of course, lowering of salt intake, and in many cases, we need to use a diuretic in oliguric or in anuric patient, the temporary anuric patient, to eliminate excess fluid in the patient. And it may also be beneficial to use compression stockings and elevate the leg for the longer time. And number 1 is that a doctor can advise you for the reduced salt intake. As we know, edema can be exacerbated by sodium, which is present in the table salt processed food. Reduced salt consumption can help in minimizing edema, especially if you are on diuretic. And use of diuretics Diuretics are drugs that induce the kidney to eliminate more water and salt, hence reducing edema. Because eliminating too much of fluid too rapidly can cause a drop in the blood pressure. It causes lightheadedness, fainting, giddiness, and damage kidney function. Thus, diuretics must be administered with caution, and the proper appropriate uses of the doses depending upon a different patient, their history, and the kind of edema that they have upon the severity. Compression stockings, it can be used to prevent and treat leg edema, although good measures and fitting of the stockings can limit the risk of discomfort. Certain stockings can cause skin irritation or pain. Body positioning is also important. Elevating the legs above the heart level for 30 minutes, 3 or 4 times a day can help with leg, ankle, foot edema. Additionally, elevating one legs multiple times a day may not be feasible for individuals who are walking. Lastly, it is not always possible to prevent CKD. Controlling diseases like high blood pressure, diabetes, and on the other hand, can benefit. Also, controlling a patient with CHF, you can also see the fatal edema in a patient of congestive heart failure, eclampsia, insufficient venous insufficiency. If you are at high risk of CKD, you should also get regular testing. Early detection of CKD can help to slow its progression. Limiting salt intake and of course lifestyle changes, choosing foods with low potassium, and having physical activities can help with reducing fatal edema caused by chronic kidney disease. Thank you so much.